there and welcome back. My name is Sheldon McLeod. This is Thinking Out Loud, presented to you here exclusively by the Saltwire Network. And I've been, doing this for a long time. And, often people say, well, where do you get your thoughts or your ideas from? How do you decide who to speak with? Well, there was something that came in through the inbox, and it ended up as a story at saltwire.com. Nova Scotia Health sets up phone line, email to make it easier for people to become a patient family advisor. And it's talking a little bit about what this is, how you can sign up for it and get involved. And it is about being, as it says here, a patient family advisor, a great way to make a difference and improve the healthcare system for you, your loved one, and others. But what is it? Well, that's what I want to find out. And we have joining us here today, we have, her title is Nova Scotia's Health's Patient Experience Lead. And Debbie, again, I didn't pronounce your name correctly. I'd love to get you to say it for me.
That's no problem. Debbie Liev.
Debbie Liev. And I wanted to first start off by asking you what exactly it is what we're speaking of. What are we talking about when we say that people can become a patient family advisor? What are they?
Yeah, it sounds like a mouthful. It's actually a volunteer position within Nova Scotia Health. It's a role that's been included within Nova Scotia Health since 2016. So they sit as a core member on one of our teams or our councils. They're also included in a variety of programs and projects throughout Nova Scotia Health as well.
Now, if I wanted to contribute to this and to help make healthcare better, and I say, yeah, I'd love to do this. Well, what exactly would I end up doing?
Oh, we would love to hear from you. We would love to hear from everyone. So what you would be doing is, it depends on your interest. So what areas you're interested in making improvements within our healthcare system. So you could sit on a provincial quality council. You could sit on a zone team or council as well. So it depends on where you're located within Nova Scotia. So if you're interested in making differences within Nova Scotia Health based on the area that you live in, that's perfectly fine as well. But what we want is, we want to hear from you. So, and the only experience you need and background is your experience with our services or within Nova Scotia Health facility. So you don't need to, we actually discourage anybody from having a healthcare background to come into these positions, because we want to think beyond our four walls. We want to hear from patients and families outside of Nova Scotia Health.
This seems eerily similar to community health boards.
So it's not, in a way, yes. However, they're directly involved in, so a prime example of what they've been directly involved in is policy revisions, policy development. Another example that will be really close to everyone's heart is our visitor restriction guidelines that were put in place of March of 2020, coming right into the pandemic. And that was very stressful for patients and families, but it was also stressful for our staff. So how did we make improvements and changes with that? We listened to patients and families and our patient family advisors, which are our volunteers. So when we were revising those visitor restriction guidelines, we actually had these volunteers, our patient family advisors, telling us how we could make improvements.
And who ultimately will accept or reject those recommendations? Whose job is that?
Accept the recommendations?
Yeah, if I'm a volunteer and I say, this is how I think it should go, who ultimately would decide whether or not it's a good idea or a bad idea?
So that actually is up to the team leads and co-leads. One really beneficial process that we have in Nova Scotia Health is our Patient Family Public Advisory Council, and that is a recruitment strategy that we have in place. We actually have some vacancies, and we're looking for folks to sit in those seats right now. So when somebody comes into this council, they ask for feedback from our patient family advisors, and they give it to them. They have to come back and let them know how it was used or not used. So they're closing the loop and letting them know how their information was beneficial, and they also have to give a reason if it wasn't used.
There is, well, in some communities, a real challenge finding volunteers. And this plea has gone out through the Nova Scotia Health Authority, looking to have folks engage with this. And how many spaces are available? How many people are you hoping to see come forward?
So we're being strategic right now. We're recruiting for a patient family public advisory council. So that's a provincial council that I had discussed. There's 12 seats, and we currently have 5 vacancies right now. The reason for that is because there's a terms of reference. So they don't have to stay with us forever and a day on a team. And when their term is completed, they of course can step down, and that's when we do our recruitment to fill these seats. So we're being strategic about that. However, we currently have 154 patient family advisors in Nova Scotia Health that sit on teams as core members on those teams and councils. So there's a number of different areas that they can be involved in. There's redevelopment projects that are going on across the province as well. And the Cape Breton redevelopment project is a prime example, where they have a number of patient family advisors from different communities in Cape Breton that give input into designing and planning for this development within Cape Breton.
I don't think you have to go much farther than perhaps your internet connection to see there are a lot of people who have criticisms, concerns, and perhaps even guidance on how to make things work better. But ultimately, if people are saying, well, you just need to fix the system, you need more doctors, you need more nurses, some of that is even coming from leadership about what is needed, and retention and recruitment is a big part of that. And I'm just wondering how where we see the value in having citizens come forward to offer their guidance, and how, if they're not experts, how that can help.
Oh, it's so beneficial, and their input would be so needed. The reason that we've done this is because we need to see beyond our 4 walls. We don't know everything. So we're looking at a people-centered care approach. We're looking beyond just the healthcare providers. We want to hear from patients and families. We want to hear from the communities. So when we work within a facility, we need a different perspective. So that's why we've reached out to have volunteers sit on teams and councils, because sometimes a different set of eyes or a different set of ears can say, hey, this is what you should be doing, or this may be beneficial for you. If they have a lived experience, especially in a service or program, that's where it makes a big difference, because they've had experience, they've lived through it. So thinking beyond our 4 walls, thinking outside the box and getting input from patients and families, you cannot go wrong. That's where we make the biggest improvements.
If my concern, though, is I don't have a family doctor and I have to wait at Emerge to be seen, that you folks already know that.
100% we do. Yeah.
So I wouldn't know where to even begin to say how to make that less of a challenge.
So this is where we work together to make the best outcomes as best as possible. And as I previously stated, we're really embracing people-centered care. And that's what that means, is we're working together with patients and families to see how we can do that. And that's where we need to hear from you. We need to hear from patients and families. If people are saying, I want my voice to be heard, I think I have an idea of what can make a huge improvement, give us a call or send us an email. We would absolutely love to hear from you.
And as you say, an email or a phone call, what happens if I reach out? How will I know that you want to hear from me?
So we will call you back.
Okay.
Yeah. And so when you call through to the telephone line, it's actually my voice that's on the greeting. So if folks are interested, we check those quite frequently, actually, throughout the day, and the emails. So we're making it very easy. When we first started this process back in 2016, we had asked for an actual application and a resume to be sent along with it. One gentleman spoke to me and he said, Debbie, I have not completed a resume since the 60s. He said, and I don't think that would be relevant. So we thought, you know what, that's being sounds like a job application when it's actually not. So it's a volunteer position. So we listened to them and we wanted to make it easier. And that's why we implemented this toll-free line. So it's 1-833 PFA join. And if folks are interested in it, call us. You do not need to have a resume. You do not need to have a healthcare background. We want to hear from you, and so that you can make a difference.
A patient family advisor. If I don't hear back, that means you don't have space for me, maybe in my community?
Nope, we will call you back regardless.
Okay.
So, whether we have a space or we do not, we usually keep a list of folks that are interested in sitting in other projects and programs. So they may be interested, for example, in sitting in the cancer care program. they may not have vacancies. So we will talk about what vacancies we have that they could sit on, such as the Patient Family Public Advisory Council for Nova Scotia Health.
And as you say, this is for input and ideas. Are these in-person meetings, online meetings? How does that work?
So they're both. Of course, once the pandemic hit, we had to go into virtual meetings, and for all of our teams. We also set up some check-ins. So these patient family advisors, they receive orientation. They have an orientation manual. They also have people that they can connect with. So if they're not familiar with certain terms that we're using in our meetings, then we can talk with them and explain what it means so that they don't feel that they're outside of the circle. They're actually a core member of the team. So there's a lot of resources that they receive as well. We have had in-person meetings in the past, and because of limitations right now, it had gone to virtual.
But again, in person sometime soon, and maybe even have snacks, which is always good.
Absolutely, we do. That's very important.
Debbie, if it just doesn't work out, no harm, no foul. If somebody says, I don't feel that I have anything more to contribute, they can just walk away?
Absolutely. Yeah, if they do not feel that they are having any meaningful experience being on the team that they're on, that's accepted, and that is respected. You know, you have to take into consideration people's time and the effort that they're putting into sitting on these teams and councils. We don't take that lightly at all.
Time, treasure, and talent, as I've heard it described. It's what makes volunteer organizations tick and move forward. So, Debbie, if again people wanted to take you up on your offer, what's the best way for them to do so? So
call our toll-free line, or you could email us as well. So the 1-833 PFA join. So that's 732-5646 or PFA join at novascotiahealth.ca. Patient Family Advisor. Thank you so much for your information, Debbie, and I really wish you nothing but success, because I think we all have something to gain by having our healthcare system working better for all of us. I agree. Thank you so much for the time.